Welcome back to Thrani. I'm Joe B. It's time for our segment,
Help you be you!
So this is the segment where you, your loved one, or your patient has questions that maybe we can answer by providing appropriate assessment and treatment techniques to improve their outcomes. I will be your physical therapist, and in my 19th year of being a clinician, I am currently a lead physical therapist of an outpatient rehab facility, an adjunct instructor of a United States doctor physical therapy program, and a visual illustrator for physical therapy colleges and universities around the globe. Our batch of questions today comes from Daniel of Melbourne, Australia. Hi, Daniel. According to Daniel, prolonged sitting, sit-to-stand transitions, stationary biking, and sleeping on a soft mattress aggravates his low back pain. The pain location is on the right hip and low back with an audible left hip clicking at times. There's also a feeling of tightness on his right hip flexors. And upon x-rays, the right leg is shorter than the left. The right shoulder is also felt to be lower with a presence of sacroiliac pain, with sleeping on a hard mattress relieving his symptoms. Now, Daniel, based from your questions, it seems like you may be suffering from an Iliopsoas Tendonitis. And the reason for that is because Iliopsoas Tendonitis can normally be caused by prolonged, repetitive, cumulative sitting. Stationary biking is also considered a prolonged, repetitive, cumulative sitting, and aggravated by sit-to-stand transitions, as well as sleeping on a soft mattress, just because you do sink in onto the mattress, which causes flexion of your hip and causes tightness of your iliopsoas. The pain on the right hip with an audible left clicking at times, the Iliopsoas tendonitis can also have that, but normally it should actually be on the right hip. The left hip clicking may totally be from maybe the lack of mobility on the left hip, just because you have been really relying on your right hip. I'm not particularly sure if you are right hand dominant. If you are right hand dominant, you can also be right leg dominant, which means that through EMG activity, your dominant side will be more active most of the time, therefore relying on that particular side of your body, causing the opposite side of your body to be less mobile, less engaged. And when you have that, you may have some more clicking at times with that particular side. The tightness of the right hip flexors on the right side can be due to, again, the repetitive cumulative activity of the sitting and the stationary biking. It tightens up the right hip flexors there, your psoas and iliacus muscle. However, the right leg being short and the right shoulder being lower may be due to the fact of the prolonged sitting. When you do sit in a prolonged manner, you can have what you call a functional scoliosis. Specifically, if you're right-handed, normally when you're sitting and you're right-handed, even when you're typing or writing, normally you tend to kind of favor that particular side. You just don't realize it. So the shortness of the leg can happen over time. The dropping of the shoulder can also happen over time. The SI joint pain can be due to just the referred pattern of your iliopsoas muscle. It refers on your right lower back and your right anterior hip. Hard mattress being able to relieve your pain, I think it's because of it does stretch your iliopsoas muscle when you sleep, and it doesn't allow you to sink in on a soft mattress, which actually, stretches the muscle and alleviates that tightness and that pain from there. So let's discuss activity modifications first. In that way, you do not keep re-aggravating the pain. Continue sleeping on the hard mattress just because it's already providing pain relief. Also, the second one may be time yourself every 20 minutes. Alarm your clock or your watch. In that way, you can get out of that particular position and do your iliopsoas stretching. Third one, instead of engaging and doing stationary biking all the time, maybe sprinkle some elliptical workouts there, treadmill, karaoke stepping, walking, anything that would prevent you from assuming a repetitive cumulative sitting position. To confirm the presence of iliopsoas tendonitis, which can bring about iliopsoas tightness, perform the Thomas test. Position will be in supine or lying on your back. You will then pull the non-tested leg, in this case the left, toward the chest until the bulge in the lumbar spine smooths out. The test is positive when the extended leg or knee lifts off the treatment table and the patient feels a stretch in the groin. If adduction of the extended leg is observed, or called J sign, this can suggest the presence of a tightness of the iliotibial band. The normal response is that the knee will not come off the table. So when you have an iliopsoas tendonitis that can bring about iliopsoas tightness, there are 3 ways to relax a muscle. Remember that. The first one is to massage or release it. The second one is to stretch it. And the third one is to fatigue it or work the antagonist muscle or the opposite muscle. To release the iliopsoas muscle, it will be difficult to release the psoas component just because it's a deeply seated muscle. For that, you can actually perform dry needling, in which case I would suggest to seek a physical therapist in your area. To release the iliacus muscle, you position yourself lying on your belly and you place the ball 1 to 2 finger breadths medial or inward the anterior superior iliac spine, or the ASIS. That is where the iliacus muscle lies. Hold that position for 90 to 120 seconds or as tolerated. To stretch the muscle, you perform the half kneeling stretch, or you can also perform a spider stretch. For the half kneeling stretch, position your patient in a half kneeling position with the non-tight leg forward. From there, you want to thrust your hip forward, tilt to the left, and turn to the left. Then you hold that position for 30 seconds hold for 3 to 5 repetitions. To activate the antagonistic muscle, specifically your lower back muscle and your gluteus muscle, you want to perform a single leg bridge on the edge of the table. Position yourself in such a way that your shoulder blades are at the edge of the table, with your hips extended and your knees bent 90 degrees. From there, you will lift the non-tight leg. You're going to try to hold that for 6 seconds and do that for 10 reps in order to strengthen your gluteal muscles, which is the antagonist for your iliopsoas. So there you have it, Dan. I hope that the combination of activity modifications, muscle release techniques, stretching, and strengthening of the antagonist muscles help you recover from your pain. If by any chance, after trying it out for 2 to 3 weeks, it is not quite impacting your pain in a positive note, I do hope that you go and see your physician or your resident physical therapist in order to discuss further imaging to really identify any structural damage that's going on in your lower back or your hip. Thank you so much, Dan, for all your questions. For our subscribers and non-subscribers, if you feel like you have questions that you think physical therapy can be of help, please send it to us here at Tharani through our comment section below, and maybe we'll make more of these videos. Thank you. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Tharani.